Monday marks World Health Day, and this year the focus is on maternal and newborn health. Now, despite advancements, South Africa continues to face significant challenges in this area. Joining us is Dr. Conrad Mashiloane, an obstetrician and gynecologist based in Durban, KwaZulu-Natal, to shed light on the current state of maternal and newborn health in the country. Dr. Mashiloane, I appreciate your time this afternoon. What does the state of our mental health system say about our priorities in healthcare?
Look, our state of maternal and neonatal care is still a concern. While we've seen reducing maternal mortality rates since 2009, we've seen a significant fall from about 150 per 100,000 births to about 113. But we're still facing challenges in terms of obstetric hemorrhage, preeclampsia, HIV. We're seeing a lot of our mothers dying from that. Neonatal care is also a concern. We're still seeing high neonatal mortality rates, which do contribute to the under 5 child mortality in South Africa because of prematurity, neonatal infections, and maternal complications. So it's still concerning. Although there's progress, there's lots of work to be done. We've seen COVID causing an interruption of the interventions in trying to reduce maternal and mortality rates, causing interruption. So it's still something that we need to work on.
Now, with the theme of this year's World Health focusing on hopeful futures, what policy changes or initiatives do you view would be recommended to ensure that this is sustainable?
Well, I think what's positive is that the Department of Health has actually developed an integrated maternal care approach where we need to be integrating all our infrastructure, integrating public and private institutions to work together. We're seeing that as a vision of the NHI, and we're seeing universal health care being a priority. We're seeing an attempt to decentralize healthcare and build up nursing and GP institutions to be able to assist government. So we're seeing government reacting to it, and we hope the reaction is going to be positive and sustainable.
Now, we've seen the significant impact of HIV/AIDS on maternal health, right? Now, how can healthcare providers better integrate HIV/AIDS on maternal health?
Well, if you look at the screening, the Department of Health has instituted protocols in terms of how mothers who are pregnant should be screened. And the guidelines are quite intensive. I mean, every mother is supposed to be counseled about HIV. HIV tests are supposed to be done routinely and repeated during pregnancy, at least every 3 months. Mothers should be prepared for for their birthing in terms of ensuring that if they're on treatment, the viral load has been reduced. We seeing are trying to make sure that after delivery, the mothers and babies are followed up in terms of trying to ensure that the treatment has worked. And if it hasn't worked, the babies are put on a program from early on.
Now, Dr. Mashiloane, the decline in teenage pregnancies is obviously encouraging, yet over 80 cases were still recorded on New Year's Day, 2025. What measures can be taken to further reduce teenage pregnancies and support young mothers?
Well, that starts from the household. I think education has to start from the household. It's because it's the mothers and the fathers who must ensure that their children are protected before they go into society. Civil society as well has to play a greater role in ensuring that teenagers are kept busy after school. And obviously, teachers, educators play an important role in ensuring that they start education, sex education very early, educating the teenagers about contraceptives, about safe sex, about consenting to safe sex, about reporting abuses that may occur in school and out of school. And ensuring that when mothers are pregnant, they have access to antenatal to clinics, ensuring that they're protected, they are tested. And I think teenage pregnant mothers should always remain a priority when delivering healthcare to society.
Dr. Conrad Mashiloane, gynecologist, speaking to us ahead of World Health Day 2025. Appreciate your time this afternoon.